Hi, welcome back to the Truth Doctor Show. My name is Dr. Courtney Tracy. I am known as the Truth Doctor. And on this show, I talk about the world through a mental health lens, using pop culture and the media as my medium. If you are returning, thank you so much for coming back. And if this is your first time, please make sure to subscribe to my channel, hit the like button if you end up liking this video, and hit the bell for notifications so you don't miss out on any of my future videos. Today, we are talking about somatic experiencing. What is it? What does it look like? And why are so many therapists talking about it today? Somatic experiencing was created by Peter Levine when he realized that animals engaged in a shaking process after they have experienced something traumatic or something that was very frightening. This, mixed with Bessel van der Kolk's The Body Keeps the Score and many other research studies that have been continuing to take a look at how the mind and body are connected, led us to this point of realizing that we experience emotions, memories, feelings, belief systems, and thoughts in our bodies as well. Soma means body. So somatic experiencing our body experiencing the things that we have been through in our lives. When we experience something traumatic, which is most of the time when somatic experiencing is being applied to trauma. However, I do have to give a note that depression, anxiety, personality disorders, eating disorders, addiction disorders usually have some type of root in trauma themselves. So you can treat a variety of different ailments with somatic experiencing, and we're continuing to do the research to figure out where somatic experiencing can be positively and statistically significantly applicable in many different areas to treat many different things. When we are traumatized, the memories of our brain are stored differently than a normal memory. The memory of us slicing an apple in the morning, for example, is probably going to go into our short-term memory, not stay there for too long, but the memory of us first learning how to do it has been stored in our long-term memory, just as some autopilot way for us to know how to do it in the future without having to think so much about it. That is very different than experiencing something traumatic. When we experience anything going on in our lives right now, for you, you're looking at this screen, you're listening to my voice, you're smelling something in the air, you're feeling something that you're sitting on, or you're holding your phone. All of these aspects of this exact moment are then being integrated into your brain and stored as a memory. When you experience a lot of trauma, your brain doesn't integrate all of those different aspects of a memory as it would sequentially with a story behind it. All of those parts can end up being fragmented, except your body still experienced that whole thing, that whole memory at once. When we go into therapy, we go into talk therapy. Often we can talk about the parts of the memory that we do remember off the bat, or we can try to retrieve those memories through a variety of different ways. Regardless, we aren't working on the body. We aren't working on the fact that when we're really scared, we freeze. When we're really scared, we fight back. We hold our breath. We hyperventilate. We start sweating. We run away. Our body is so engaged in our life. So, somatic experiencing. What are some of the things that somatic experiencing does? What are some of the interventions and tools that can actually help us release and relieve our bodies of some of these traumatic responses? The first one is just somatic awareness through somatic experiencing. Can you feel your body? Do you know what it feels like when you're happy, when you're sad, when you're sitting still? So many of us are so much more tense in our bodies than we think we are in any given moment. So try looking up something like a body scan or a body scan meditation or progressive muscle relaxation. These are ways for us to get in tune with how our body is actually feeling in any given moment.
Take a moment to think of just flexibility, love, and trust.
So the first one is called somatic awareness. Are you aware of what is actually going on in your body to begin with? The second one is called movement. Our mind and body are very much connected. So things like Tai Chi, yoga, really slow meditation and breathing and movement, Pilates, depending upon the certain type of class. When we engage in actual slow movements of our body, engaging our mind, it allows our mind and body connection to grow stronger. And the last one is co-regulation or self-regulation. Self-regulation, an example of that would be placing your hand on your belly and one on your chest and engaging in belly breathing or engaging in 4 square breathing, which is where you inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds, and so on. If you are experiencing a lot of tenseness, then the 4-7-8 breathing technique might be better, which is where you breathe in for 4 seconds, hold for 7 seconds, and then exhale for 8 seconds. Doubling the length of your exhale is significantly beneficial because it's telling your body and your brain you have time to exhale. You're not being chased by a lion. You're not being attacked by a person. You are not engaged in a situation that is supposed to be causing you severe panic and anxiety, even though your body might feel that way. It starts to tell your body, no, we have time to exhale. We have time to calm down. Now, co-regulation is really important because we are social beings, and it allows us to release the emotions that we need to and contain the emotions that we need to. And this is a really, really great clip and example of that. I hope that you continue to look into somatic experiencing because it is such an important aspect of the mental health field today. We need to be mindful of how our body feels, how our mind feels, and how they both feel together. Again, my name is Dr. Courtney Tracy. I hope that this video was helpful. Subscribe, hit the bell, hit the like button, and as always, I am glad you exist.